Everyone, we're going to get started. Good afternoon, and welcome to a very special edition of the CanNRT Research Forums, our Distinguished Speaker series, which highlights presentations from renowned international speakers. Today's forum, Whose Voice Counts? Inclusive Approaches to Autism Research, invites us to explore meaningful strategies for centering autistic individuals, families, and communities in research. My name is Eliana, and I'm the Training Program Manager at the Canadian Neurodevelopmental Research Training Platform, or what we like to call CanNRT. CanNRT is a collaborative training environment dedicated to advancing research excellence and fostering sustainable, equitable pathways for early career researchers working in neurodevelopmental conditions across Canada. Through multidisciplinary cross-sector learning, mentorship, and connectivity, we support a vibrant national community of emerging researchers. One way we do this is by hosting forums like today's, which bring our community together to share diverse perspectives, exchange knowledge, and build collaborations across neurodevelopmental research. So before we begin, I would like to acknowledge that CanNRT headquarters are located on the traditional territory of the Haudenosaunee and Anishinaabe nations, a land that has long served as a place of meeting and exchange among Indigenous nations, including the St. Lawrence Iroquoians, the Huron-Wendat, and others. So it is now my pleasure to introduce to you today's speaker, Dr. Sarah Dababnah, an associate professor at the University of Maryland Baltimore with appointments in the School of Social Work and School of Medicine. Her research brings a global perspective to family-centered, community-based approaches for reducing racial, ethnic, geographic, and socioeconomic disparities in autism and neurodevelopmental disability services. Dr. Dababnah is recognized for her expertise in culturally responsive practice and policy and has contributed to national and international initiatives, including work with the World Health Organization in Egypt. So please join me in welcoming Dr. Dababnah. Thank you for being here.
Thank you so much. Thank you so much. I'm going to try to do my best to stay near here because I know the microphone is here, but I'm like so delighted to be here. It's really an honor to see so many familiar faces and to meet so many new people. I know there are many people online as well, so thank you all for being here. Just to tell you a little bit about my plan for today. So just today, before I get started, I want to say that my talk about inclusive approaches in autism research will draw heavily on qualitative approaches, because that's where we can really kind of see participant voices showing up the most clearly. But everything that we'll discuss, power sharing, positionality, community partnership, and cultural responsiveness, they apply across all methods. So just for folks who might not be as knowledgeable about qualitative research, I'll give a quick overview of what that means. And then I'll share many different examples of participant voices from across the autism research spectrum. And for those of you who don't know, my research focuses on parents and families of children on the autism spectrum, so many of the voices will be theirs. And I'll share some strategies for inclusive research and dissemination, and then hopefully we'll have some time for discussion and question and answers. So before we dive in, I just want to ground us on what I mean by inclusive research. And no matter what method that we're using, whether it be qualitative or quantitative or mixed methods, inclusive research should always involve autistic people and families at all stages. So, anywhere from like really starting and identifying research questions all the way to dissemination. And this also means like using research methods that honor culture and context and lived experience. And this is a really important point. So how can we share power throughout the research process, including in the design and data collection and analysis and dissemination? So again, I'll start with qualitative research because, that's where inclusive practices really show up very clearly. But again, the principles that we'll talk about, seeking context and elevating lived experience and understanding meanings and all of those things really strengthen quantitative and mixed methods as well. And I just want to confess, since I'm amongst friends, that I didn't originally plan on using qualitative methods at all in my career. My background's in public health and all of my training was very quantitative heavy. And I kind of viewed qualitative research as less rigorous. But on my first job, it was a study that involved a really large qualitative component. So I certainly had to learn on the job. But over time, I really came to appreciate that it kind of pushes me to see experiences from new angles and like this picture kind of putting on different para classes. Um, so qualitative research, there's no one method. It's oftentimes defined in contrast to quantitative ones. Qualitative data are usually words on observations versus numbers. And the study aims are usually trying to seek to understand rather than to measure or quantify meaning in context and lived experience, especially in areas where voices have been marginalized. And qualitative approaches, no matter what your larger group, what's in your larger toolbox, can be a really powerful and inclusive tool. It's interdisciplinary, so it has its roots in a lot of different types of disciplines. And it's multi-level, so it can really answer questions about what happens and why and with what effects from all the way from the individual to the macro levels. And it's sort of inherently participant-centered. And so, some of the methods, including like interviews and observational studies and so on. And it's just a reminder that qualitative research is just one part of a larger methodological toolkit. And these diverse methods can kind of fit across the research spectrum. So they can be exploratory or pilot work. So just sort of generating a hypothesis, for example, or using qualitative data to add depth to quantitative data. So kind of like the step two to explain why behind quantitative findings, or parallel studies where you're using both methods at the same time to try to extend your understanding of a different phenomenon. And so, kind of taken together, you can see how these different methods can support one another in an inclusive research. It's never about just choosing one method and sticking with it because you feel comfortable with it. It's really about using the mix that best centers autistic people and families and communities. So in the following slides, I just want to share some of the voices for my research. And I've really attempted to pick examples from different stages of the research spectrum that I just described. And just again, as a reminder, I just want to note that my research almost exclusively focuses on parents of young autistic children. So those are the voices that are going to come up mostly through this presentation. But later on, I'll share tips about how to ensure that you're bringing autistic people, community advocates, and other partners into the research. So my first example was extremely exploratory. When I first started out this research, it led up to these papers in about 2011. I couldn't find any prior autism studies in Palestine at all, not even prevalence estimates. So I decided to take this very qualitative approach. In terms of our methods and our sample, we interviewed Palestinian parents of autistic children in the West Bank, and we had about 24 parents who were interviewed. And here are some of the key findings that emerged from this very exploratory study and this is directly from the parents' own words. So the first kind of theme that we found were inadequate screening and assessment. And so one parent said, I told the doctor my daughter does not answer at all. And he said, she's just being naughty. Lots of parents talked about geographic barriers to services. One person said, I only go to one center because it's the closest to me. There are difficulties in getting to other centers because of the checkpoints, the army permissions you have to get, and the fences. Many parents talked about limited availability of services, with one saying, we're on the sidelines and forgotten. Nothing is available for our kids. And many parents also talked about their advocacy work, with one saying, we created a center especially for autistic children. They go 5 days a week from 8 to 1, just like schools. They have teachers to feed and train them as much as they can, and they have a bus that picks them up and returns them back. And at least they get to change scenery when they leave home and go outside. And so when I conducted this study, well over a decade now, it was really overwhelming for me to know where to begin. And fortunately, I think one of the really important parts of this study was that it allowed me to better connect with community partners and with other researchers to really kind of think about what are the next steps. And so despite like these massive structural barriers that people were experiencing, families and local providers were very motivated to strengthen their local service systems. And so then, thinking about all these potential strategies of how to leverage existing knowledge and resources in coordination with not only these local partners, but also with global ones as well. And so one potential strategy, which I will humbly share with folks in the room who have a lot more experience with this than I do, is the Extension for Community Healthcare Outcomes, or ECHO, which is a training and mentoring model that builds knowledge and skills for non-specialists. And I'm very delighted to work with many individuals in this room and across the globe to develop an autism-specific ECHO for humanitarian workers and other professionals in conflict settings. And actually, the first session was today. So I'm just really feel like today is just a wonderful day. And we included a qualitative component to really try to better understand what providers need before we even started implementing the program, and to inform how we should adapt the model to make it more responsive to what those needs are. Um, and then the next picture is from a meeting with the World Health Organization and UNICEF colleagues in the Eastern Mediterranean region. And there, the autism was just part of the conversation about how can we kind of embed autism into this larger global child mental health initiatives, and how we can really ensure that we're supporting neuroaffirming approaches and global planning. So the second example is how to use qualitative data to add depth to quantitative data. Just a little bit of background. So we, of course, as many of you probably already know, that we have a very large body of evidence of the benefits of early intervention for developmental delays. We have decades of studies that have documented racial disparities in autism assessment and early intervention, and in the US context, particularly for Black American children. And we know that when children don't access early intervention, there are negative short-term and also long-term consequences, not only for that child, but for that child's family as well. And when we first started this study, this work many years ago, we could only find one peer-reviewed study that kind of investigated that why. Like, okay, we know there are racial disparities, but why? Why do they exist? And so this first study just asked the parents that, why? Um, and just to, I think it's always important to understand the context. And so as we're planning for this study in Baltimore, it's really important to remember that Baltimore is a majority Black African American city. There are lasting effects of housing discrimination and segregation in the city. And this is a kind of a picture of where historically Black and African American individuals were not allowed to live. And you can kind of still see that segregation lasting to this day in the city. About a quarter of the Black population in Baltimore lives underneath the poverty line. And so as we're kind of developing these studies to figure out the why, it was really important that we engage a number of collaborators across the city who are not only interested in Black American families, but also other racially and ethnically minoritized families as well. So just to recognize many of the individuals who worked with me on this, the Center for Restorative Change, we had a community advisory board. There's a local nonprofit we work closely with, and clinical and community agencies. So one of the biggest barriers to timely autism diagnosis were providers just simply ignoring parents' early concerns about child developmental delays. And so this is an example of that, of a quote. We interviewed 22 parents, and one parent said, "It took a while to convince our pediatrician. I feel like we have to fight more. I feel almost like he's not talking, no big deal. There's these milestones that are set up to catch problems, and doctors just kept on pushing me off." And so another barrier was just provider implicit bias in the literature. So one of irritation I have with some prior studies is that the literature oftentimes conflates barriers related to poverty with those related to race and ethnicity or racism. And our research found that even when families are not low income, they continue to face pretty significant discrimination in the service system. And so this is a quote from a Black woman who's a college graduate, and she's a mother of an autistic child, describing her interactions with her child's healthcare providers. And she said, you assume because I'm Black that I might not be as smart. So I surprise you when I give you all the information. I would get this whole lip service with the doctor. Well, you can't do this with Medicaid, which is our healthcare system for low-income individuals. And she said, I don't even have Medicaid. I have private insurance. And there are these assumptions like, I'm just this person that has multiple kids. This is a Black woman. And if you see my three kids, you assume I don't have a husband. And so there were so many things that came for us and our team that kind of came out of this initial study. And so we, again, kind of like the study I described with Palestine, we're thinking like, there's so much here. What's next? And so just some of the few implications, sort of at that individual and family and community level, where maybe how can we better train advocates to provide culturally relevant support and guidance to families who are navigating these systems of care? Like, doesn't need to be sort of a quote unquote professional when we have individuals who are very motivated to, help to work alongside those who are earlier on in the process. At the systems and macro level, it's really important for us to, and it's hard because we're all professionals and clinicians, right, to kind of shine a light on ourselves and think about how can we be more aware of these racial diagnostic disparities and the potential for discrimination. And then also sort of the measures that we use and trying to better understand the cultural relevance of measures. And so that early study and also our clinical experience, and I'm a social worker, led us to consider, how these really commonly used quantitative measures might not be telling the big story or the full story. And quantitative measures are very powerful and are helpful and are definitely easy to implement. But they can also benefit from qualitative input as well to make sure that they're culturally relevant. And so, as you all might know, there have been so many studies finding that parents raising autistic children oftentimes have higher levels of stress. So in this study, we asked parents of Black autistic children to complete a common measure, the Parenting Stress Index, which in brief just looks at parent-related stress, such as isolation, and child-related stress, such as hyperactivity. And after parents completed the study, the scale rather, we interviewed them to ask them about stress. And so as you can see here, the quantitative scores were fairly high with about 42% in the clinically significant range. But when we found out when the qualitative interviews gave us this much bigger picture of why parents were stressed. And so this, for example, this quote I'm about to show you adds a lot more depth to our understanding of parent isolation as a stressor. And so this parent said, I feel like sometimes, even when I go to the support groups, I'm the only African American parent there. I don't hear from other people who share or have the same types of struggles. And we also found that some stressors that parents mentioned in the interviews were totally absent from the parenting stress index, such as neighborhood violence and trauma. And so this was a mother who was remarking about her concerns after her child's father was murdered. And she said, it breaks your heart. That's really my biggest concern with my son is that trauma. He needs other stuff, that trauma. And so unless you're really talking to the parents, you're going to completely miss these massive stressors in their lives. And so the interview data also helped us to better understand how parents cope with stressors. And we did a study which focused on that. And so parents talked about religious and spiritual practices. They talked about inclusive support groups. But they also talked about employing code switching and self-control to kind of not sound like quote unquote angry when they're advocating for their child. And so while, we think about advocacy and problem solving as like helpful to cope with stressors, but when you feel like you have to sort of present in a certain way, so people listen, that obviously makes it much more difficult. And this research really demonstrated that we can't just ask parents to like meditate and feel better. There's really the onus is on clinicians and it's on our systems of care to improve in order to better support families. And I just want to share with you a few additional parent voices from across several of my studies, reflecting different racially and ethnically minoritized families. So this was one focused on racism, where one parent said, Really, honestly, the most I worry about now, and I think it's hard not to, is just everything that's going on out there. Not even just with the cops, but just anyone labeling my son, quote unquote, black men are angry. Him reacting a certain way because someone took his lunch, all hell will break loose. And I worry about it. He's so sweet and so kind and so sensitive, and I worry about that. Another study that we did that focused on Asian American families, one parent said, for Asian parents who are new to American culture, due to cultural difference regarding autism between Asian and American, it usually takes a longer time for parents to acknowledge a situation and to seek evaluation and support. And I've heard that some Asian American parents are still denying the diagnosis and their children do not get the services and therapy that they need. And another study we did with Arab American families focused on isolation from their cultural community, where one parent said, we have a community center for the Arab community, and we would get together at least once a month. And anytime my son would scream or be sitting there playing by himself, there's looks and there's whispers, and it kind of kept us out of the community for a while. I kind of distanced myself a little bit. So I really want to emphasize that it's not that stressors are unique to any one group. Racism affects other racially minoritized families as well. A stigma isn't just in one community, but kind of taken together, you can see how these parent voices show like why we need to understand intersectionality, how race and autism and ethnicity and class and all of these different types of differences interact, and why it's always so critical we respond with a culturally humble lens. And my third and my last example illustrates where the quantitative outcomes and qualitative process data can be interpreted together. And I always want to start with my intervention research, making sure that the program is culturally and contextually appropriate. So these are just some example aims, like we want to measure changes in parent, child, and family outcomes. We use different models to make sure that we can test those relationships. So those are really important, of course. And these are usually measured, quantitatively using surveys and so on. But there are other important aims like that can have qualitative elements, like engaging partners in the local adaptation and implementation of an intervention for a specific population. What are the participation barriers and facilitators, and how can we evaluate fidelity and acceptability? Usually thinking about this approach from a mixed methods design. So just a little bit of brief background on intervention that I'll talk about in the next few slides, called Parents Taking Action. This was an intervention that was originally developed for and by Latinx caregivers of autistic children by my colleague Sandy Magana. In Baltimore, we adopted it for parents of young Black children with an increased likelihood for autism. And we worked with parents of autistic children ages 9 and above, who we call parent leaders, to deliver the program one-to-one. And we first convened this group of advisors who were mostly parents of Black autistic children in Baltimore to guide the adaptation. I know it's probably really hard to see, but the first page of this manual begins with a story of a young autistic man named Malcolm, and he is one of our advisors. And he's a non-speaking man, and he was able to sort of integrate a lot of elements of his lived experience into the program. And this is just a screenshot of my colleague, Dr. Wendy Shaya, who is a parent of a now adult autistic man, and she narrated all the videos that accompanied the manual. And once we piloted the program, the interviews with parents helped us to understand, what helped them to participate. So many of the parents talked about how important it was to have other parents leading the program. So they kind of talked about parent leaders as mentors. So one parent said, doctors can give all the exams, but if they don't even have a child with autism, they can't really tell you and actually give you the whole 100%. They can give you 50, but they can't give you the whole 100 because they haven't actually dealt with an autistic child daily. And then other parents talked about the relevance of the program for Black families. And one said, I think PTA was relevant because a lot of times in the African American communities, the disparities, I feel like it gets pushed under the rug. My parent leader and I actually spoke about that. Not enough attention is put on African American families and what we go through. So we worked really hard to make the program fit parent schedules rather than force them to like adhere to like our schedules in the 9 to 5. Despite this, we still had, lots of cancellations or parents having to reschedule, and we really wanted to understand why. And that parents' voices helped us to, kind of think about what the next steps might be. So definitely the parents like the flexible scheduling, like meeting on the weekends, for example. And one parent said, 95% of programs won't offer times outside of typical weekday work hours. It's either you do it the time I can give you because that's the time I have opening, or you can't do it at all. And that's just how it is, and that doesn't work. And some caregivers really liked the opportunity to meet in different places outside of their home. Some individuals were experiencing homelessness or domestic violence, and so a home wasn't an option for them. And then other parents talked about, kind of push back on this idea of like needing to be on a schedule or needing it to be weekly. And so one parent said, parents taking action gives us time to actually embrace it, learn it, fill it out, and see if it works. And if it doesn't work, as a single mother doing this, it takes a lot of patience. And with patience, you need that space in between to actually be able to cooperate with the child and incorporate everything that you need inside. So, kind of thinking, how can we use mixed methods to guide next steps and keep like refining the program so it better meets families' needs? So, I've worked with many other researchers on thinking about cultural adaptations for other racially and ethnically minoritized groups, and this is just an example of the manual in Korean, led by my colleague, Dr. Iran Kim. And in Maryland, we started working with pediatricians and local clinics to expand the program to people on the wait list. We have very, very long wait lists. And during that time, parents do not receive any support. And so, this was kind of filling in the gap as they waited. We also decided to reorganize the program into kind of like these different modules and to introduce some of the more like baseline content a little bit early, just to better meet parents' needs. One of the many things that we learned from being forced to be online during the COVID pandemic was, online works pretty well, and parents really liked it. And it's because it's one-on-one. We felt like it was a lot easier to engage them anyways. And so we continued with that. And we also added different supports for parents who were frequently missing and canceling appointments. So my last little bit is about using mixed methods and intervention studies is the collective work that many folks in this room have been a part of with the World Health Organization and on the Caregiver Skills Training Program. And then for those of you who are not familiar, it's really intended to fill in this tremendous gap globally we have in terms of autism services. And so, there are so many that I can't fit everyone everyone on the screen. But this is not the work of one person, of course. There are many individuals and organizations who have been working to implement this program in 40 plus sites, I think, across the world now, with a strong focus on underserved communities. And then there's just a screenshot of a paper of the implementation in 3 regions of Egypt and some work that we've been doing with Ethiopian and Eritrean families in the Washington, D.C. area. So I know I've covered a lot of very different studies, and I hope it's clear that we should be adopting our research methods to enhance inclusion at every single stage of inquiry. And I'm happy, during the Q&A to talk more about any of these studies and questions you might have. But first, I just want to summarize just some recommendations for how you can conduct research ethically and inclusively. And I think that these recommendations apply no matter what type of research that you're doing. So this is not a slide I created, but I love it. I refer to it all the time. I really appreciate that it sort of adds illustrates that there's at every single stage of the research study, you can be including individuals' voices and other partners throughout that whole cycle. And in any research study, it's so critical to consider the power that we have as researchers and as clinicians, and how can we share it from the very beginning. And sometimes when speaking with clinicians or researchers are like, oh, we have kind of very flat organization, like everything's fine. And sometimes that can obscure some of those power dynamics, even if they're perceived power dynamics. So, between a child and an adult, of course, a doctor, a layperson, the PI, and a research assistant, et cetera. And, making sure that we're budgeting for participant payment and culturally relevant compensation methods. Like in some of my studies, parents didn't feel comfortable accepting money, but there are other ways that we can compensate them for their time. And then, as we're including advisors and other individuals, of course, the research team as well, making sure that they're also being fairly compensated as well. Sometimes the IRB or the ethical review boards can add in barriers. And so, kind of thinking about how can we work with these boards early on to address potential constraints that they might have, like including like a lay co-researcher on the protocol. And during data collection, even from the very beginning, when one is introducing themselves, like how do you introduce yourself in the study? How accessible is the interview and the study questions, survey questions? Of course, always thinking about how we can use plain language and avoid jargon, offering visual supports and examples, allowing multiple response formats, spoken, written, AAC devices, etc. Always piloting the questions with autistic individuals for clarity and for cultural and linguistic validity. And thinking about things like where are we collecting data? If we're doing it in someone's home, for example, do they feel compelled to like offer you food, or do they feel embarrassed about showing you different parts of their home, or whatever the case might be? Whether recording is acceptable, and if there are alternatives available, like typing. And this is sometimes hard for researchers, but making sure we're flexible to adjust when needed. And so including that flexibility in the protocol is really important. So this is an image, some of you might have seen it before, of the cultural iceberg, and it kind of illustrates how culture is much more deep than, just the clothes that we wear, the language we speak. So much kind of exists below the surface. And all of the ways that we're thinking about, like the words that we use, the history that we have, the experiences that we've had, and so on, they impact how people interact with us, of course, but they also impact how they interact with our research. And even thinking about like what they might be comfortable sharing and with whom they might be comfortable sharing something. And are certain words like, one I always think about is mental health. That might be understandable for individuals, but that might be deeply stigmatized. And so thinking about if there are alternative words that we can use. And because of this, we want to understand our own positionality meaning, like our identities, the roles that we hold, the power that we hold, etc. That's always essential in research. And so this process of reflexivity is just throughout the whole research process, understanding the choices that we make in the study design and the data collection and how we interpret the data and the partnerships that we have are really important. So just want to share with you a couple quick examples of that. So in the studies I shared earlier with Black and African American families, I was very mindful as someone who's not a Black American, that people might hesitate to share information with me. And so that's one of the reasons that I partnered very closely, one of the many reasons why I partnered very closely with my colleague, Dr. Shaya, because as a Black parent of an autistic child, she brought insights that really were very important that enriched the studies that we were doing. And this might be hard to see. I'm happy to share the paper if that would be helpful. But it does, in the paper, we were very explicit in how she introduced herself. And it also was very clear about my role in the research as well and how I reflected on my positionality with the data during the analyses. So In this example from Palestine, I did have a little bit more insider status given my ethnic identity, but I was also very mindful as well that as someone who was born in the United States and as someone who was affiliated with a U.S. university, that gave me some outsider status as well. So I was very clear again in the paper in describing, how I considered those kind of dual type of status as we were analyzing the data. And so, how can we really center participant voices and analyses? So, one of the most important things is prioritizing a diverse research team. So, always aiming for the team to reflect your target population, certainly including autistic individuals, individuals from racially and minoritized groups, et cetera. Utilizing member checking and co-analysis when appropriate. And so, verifying how we're interpreting the data with people who were directly involved um, with the research or with whatever that you're studying. And then, if possible, to involve them in analysis, I found has been really helpful. Using direct quotes, so hopefully you saw some of that today. So, better that we share participant voices directly rather than summarizing them, just to make sure that their experiences are authentically represented. Interpreting with a strengths focus. And so it's so easy just to kind of go right to the deficits and the challenges that individuals might be experiencing, but not overlooking all of the many areas of strength that they might have. And in qualitative studies in particular, but on all studies, of course, confidentiality risk can be much higher, especially if have a very small sample size and a focus on marginalized communities. Even if you're not saying people's names, sometimes it can be clear. So making sure we're really thinking clearly about that. And participatory designs like photo voice is like an increasingly common research method. That's actually, I think, is like a really fun research method, and one that, sorry, the microphone is giving feedback, but is one that I think is like a really completely inclusive way to solicit people's voices. So we shouldn't forget, that a very important step of like, once we've done this like beautiful study, well-designed study, like how can we get that information out to individuals in an accessible way, in a meaningful way that really shows them the time and respect, for all that they've contributed to the study. But I find that, to be honest, that sometimes it's the trickiest part. Like, how do you kind of get all of this out to folks? Um, and this picture is an example of a study that we did with Asian American communities in Maryland. And one of the things that we did was, because there were so many languages that were covered, we sort of developed these short like snippets. This one is in Hindi, and we kind of did different things to kind of get them out to community members in more lay language. But besides written content, one could think about like other culturally relevant formats to disseminate, like stories or other things like that could be really helpful. And last but certainly not least, like thinking about how to advocate for funding and policies that ensure equitable access to services and uphold human rights. And I mean, I think there's sometimes an assumption, that we, as researchers, we don't have an advocacy role, and I really strongly disagree with that. I think that we're interacting with people, we're hearing their stories. The goal isn't that we should just like let it lie somewhere in a paper that like 5 people will read. At a minimum, I think that we owe it to those participants to make sure that their voices are contributing to some kind of positive change. So as I wrap up, I just want to again emphasize that inclusive research isn't tied to any one method. Whatever we're using, whether it be surveys or interviews or a big randomized controlled trial, we should always be centering autistic people and their voices in our studies. We should always be have a culturally humble lens, and collecting data in ways that are ethical and accessible. And we should always be returning those results to communities just to show care for the time and expertise that they added. And so my hope is that these examples are helpful, and I'm happy to take any questions that you all might have.